Good afternoon, everyone. Welcome to Delegation and Prioritisation. I would just like to let you all know that we are recording this session. So if you do put on your cameras or you come off mute and talk, that will be part of the recording, which is absolutely fine, just as long as you're aware of that and happy with that as one of your choices. So we just wanted to make sure that you were fully aware. Going to start with a little bit of housekeeping to go over a few things, and then we'll go straight into the session. So hopefully that will be helpful for you. So please do ensure you're on mute, particularly as we're recording, because if you are not on mute, you get lots and lots of feedback. But of course, that doesn't mean that you can't come off of mute to ask questions. I will equally be looking at the chat for any questions that you may want to ask. I am working on my own. I don't work with anyone turning over my slides or watching and monitoring the chat for me. So if questions are placed in the chat, it may take me a few moments to get to them. I may wait till the end of a section, but I will get to answer anything that does go in there. The other reason we like you to stay on mute, apart from the feedback that comes through on the recording, is because obviously if somebody comes in your room with some great piece of gossip, you don't particularly want it heard to other people on a training session, and you definitely don't want it recorded and held there forevermore. So always a good idea to watch that while you're on these sessions. The slides and handouts, and there will be quite a few handouts, that will all come out to you at some point after the session. It doesn't come out from me, it comes out directly from GP Excellence, so look out for any video coming out from them. If you do get disconnected, just rejoin. You don't need to tell me that you've maybe missed something. That's what you can catch up on the recording if you need to. And if the slides stick or anything happens with the audio, they have been doing a little bit of Wi-Fi work around where I am, and it does occasionally cut out, and I may not be aware of that. So I am happy for you to write in the chat that something has happened if that's the case. These sessions have been put on not only to help keep up the practice manager support that we are trying to keep up from GP Excellence, but also because I believe some people will be doing their level 5 operations apprenticeship alongside GP Excellence, and this was put on as part of the training for that as well, because it sits alongside some of the modules to prove that you have got your CPD up in that area. So that can go in your, what they call your off-the-job training for your apprenticeship, if that's the case of what you're doing. Or you may be here just to catch up and refresh and remind yourself. I know certainly I can see some familiar names who have joined today, who have been at a few of my sessions. For those of you that haven't been at my sessions, who am I and why am I doing this? Well, I've been a practice manager for many years. I have recently retired, but ended up straight back into practice, a different practice, locuming, who had some issues with their CQC. So, and part of what they'd had some issues with was leadership. So this course is certainly part of that. Learning how to delegate and prioritise your work is a very significant part of leadership for CQC. So useful in that way too. I am a trainer and mentor for the Lancashire Training Hub, for the LMC, and also for you guys in Manchester under GP Excellence. And I'm a private consultant for estates and also in finance, in basically practice-based stuff. So quite busy occasionally for someone who should be retiring. So delegation and prioritisation. The reason we do this as a separate session, apart from the fact it is part of some of the apprenticeship work, is also because we do find that many practice managers do really struggle with delegating. They find delegating quite a challenging thing to do, and often have the thought that it is easier to do the work yourself. Although that may be true the first time you do a piece of work, when we have to work and do repetitive tasks year on year, it is definitely better to learn how to teach somebody how to do that particular piece of work, because in the long term, you will save time. And that will mean your time can be freed up to do something else. It is a very hard habit to break if you are used to doing everything yourself or micromanaging everything that somebody else does, but you will find that if you can learn to let go and actually delegate a little bit more, then you will actually find that it'll be quite a new and refreshing way of working because your time is not completely taken up. And to give you some examples of the way that we should be thinking is we need to start thinking of ourselves quite in the way that consultants think of themselves. You think about a consultant that's sitting up here, they don't do the bloods for their patients. A phlebotomist does that. They don't do a lot of the paperwork and the admin. Somebody else does that for them. And we need to start thinking of ourselves as important as those consultants, but we are in the management field. We are like a management consultant looking down on our team and helping our team to progress and do all those other jobs so that the whole package is done. And our job is to oversee it and make sure it's done correctly. So that's a way of trying to teach yourself how to delegate. I know it's still going to be a challenge for some of you, but it is definitely worth thinking about trying to change your ways if you don't delegate now. And another reason that we need to start thinking about things is juggling that ever-growing workload that's coming through the NHS. So we need to start thinking about how to make sure all of our jobs are done and getting all those pieces of work done ahead of time so that we can actually know that we are going to achieve all our targets, whatever happens. Really, you've got to hope for the best, but prepare for the worst. Do not always work on deadline. The reason I always suggest you don't work on deadline, so you plan ahead, no surprises, because if something suddenly comes along and it's the final day to get your submission into the ICB, that perhaps funding will come through for you, or something comes through that you really need and you've left everything till that last day, that could be the day that you have to deal with emergencies in the practice. There could be a fire, a flood, you could lose all your electrics, and anything happening like that means you are then writing reams of stuff to the ICB to apologise that things weren't in. So if you can try and work a week ahead, it's really helpful. I always set everything up on my calendar, on my Outlook calendar, for a week before it's due. And that way, in my head, that's my deadline date. So if I can try and get those things done, and I do that by action planning everything. So all of my enhanced services, my QOF, everything is action planned to work throughout the year to make sure everything isn't being done at the last minute. And therefore, if you do have staff sickness or anyone off for any reason, you can manage to catch up because you've got yourself ahead of time. So when we're looking at things like that, you need to make proper action plans for your enhanced services. We're going to be coming up to the time soon when all those new enhanced services and new contracts are going to come out, and therefore it's a time to get in the habit of working through action plans to make sure everything is done so you can make that money flow throughout the year and get all of those tasks completed. As you can see on the screen, that's a weight management action plan. That was a way of making sure that we sorted our referrals throughout the year to get all the extra money in. Weight management, nice, easy one to discuss because it's one that doesn't require appointments, it's digital. Along with the paperwork that will come out today will be that weight management action plan, along with other bits like that, so that it can show you how to action plan if it's something that you haven't done in the past, to give you those ideas of ways to make your work easier. And you'll notice there is a column on there that says who will do this piece of work. That cannot be you in that whole line because you are one person. So it is also teaching you how to learn and work forward to actually start considering if we action plan things and give some of that work to other people. That way we will make sure that everything gets done. So plan your enhanced services and your contracts, add your diary dates into your Outlook for when things are due, but maybe a week before, and then with a final date where it absolutely must be in. You can work with written lists if that helps. Some people like whiteboards. Doesn't work for me, but I know some people have whiteboards with all of their big lists of things that they want to do, so it's right in their face when they come in. Even blocking off stuff in your Outlook to do that piece of work, just to make sure that you've got time put aside to complete some submissions or do anything that you need to do. If anyone else has any wonderful ideas of ways that they plan things, not including list writing and whiteboards, please feel free to pop them in the chat to help anyone else if you've got some fantastic ways of doing things, and we can all learn off each other. But I will leave you to, if you decide to do that. But there are all sorts of different ways that you can work and plan through things. Don't start writing lists of things that you've already done, though, just so that you can tick them off, because that can then become not a good way to learn how to prioritise your work. This is about actually working forward. So why are we needing to do this? Well, our workload's increasing. I hate to mention the dreaded COVID word, but when those of you that were around during COVID will know that a lot of practice managers that were coming up to retirement then, there were quite a few partners out there that thought because everything was guaranteed, your quaff was guaranteed, all sorts was guaranteed during COVID, they didn't need to have that big handover time. They could get away with only paying a salary and then having a gap and then a salary again, rather than a handover and a crossover period. So lots of that experience went away and retired. And therefore, suddenly when we do have to hit all our targets again, it's unusual for people. They're coming into roles without that handover and without that experience to help them through. Lots of people are coming in with experience from other workplaces, from banks or finance areas, things like that, which is great. And then we do get lots of interesting things we learn from that. But general practice is pretty unique. I don't know why I can't get my words out. It's only general practice where you're the HR, you're the payroll department, the legal department, the finance department, and in some of your surgeries, you may be the maintenance man, or depending how small it is, or you may be there trying to clean up spills and do all sorts of other things. So it's a really challenging job being a practice manager. And therefore, to avoid burnout, because burnout is something that is becoming more and more prevalent in practice managers, we need to learn how to prioritise our work. And I do really quite like this slide that has been made. This particular picture came in from the LMC originally, that shows the huge amount of work covered by, they do put a GP and their team. I do question that a lot of this is actually organised by your practice manager. So you guys are heavily at work there. But unfortunately, the public have also started to have what we call the Daily Mail effect, or the Amazon effect, where they are so used to getting everything straight away, wanting that demand of things, and not really understanding. They're often complaining before they think about actually what a great deal they get out of the NHS from in the UK compared to what they would get in other countries. So unfortunately, we're on the back foot all the time with our patients. And so if we can try and get ahead and improve things, it will actually make things calmer for us and better for our team. And if your team are happy, they are not knocking on your door quite as often, which gives you that breather to be able to get on with things. So as we work through the things that challenge our practice managers, I know that probably the biggest challenge are our emails. Those emails can build up massively, and we've got to find ways of controlling them. Because when we can control them, we can be able to, we can free up some time. It is wasted time if you are reading the same email 3, 4, 5 times because you've half read it and need to keep going back to it. And unfortunately, none of us have time to waste anymore because the job has got busier and busier and busier. So because of that, we try and teach really simple ways, and most of you will be doing this, but there will always be someone on the group that isn't. Real simple stuff, right-clicking and junking regularly. If you don't ever use locums, or you rarely use a locum, and definitely don't use agencies, all of those emails that come flying through about, I've got this great nurse that wants to work out of Blackpool, but you're in Manchester, so you don't need to know that anyway. If you start right-clicking and junking those, then you will have a freer space. You will only have the more important emails coming through to you. Unfortunately, we can't always junk ones like the ICB ones. We have to actually read those, but we can certainly get away with certain ones. And then we can also start dividing up our emails. So if you could open your emails on an app, it will come out like this. Now, some people have worked out how to do this on their laptops. I'm not great with IT, but I can certainly get it up like this on my iPad or my phone. And therefore, it will come up with things like focused and other. And other is the stuff that you probably can delete the majority of the other without reading any more than the first couple of words. And that can save masses of time if you're not opening up each of those emails. That'll be things like those of you that work with TeamNet for annual leave. You will find that you'll get an email to say that your reception manager has given your receptionist the afternoon off that she's requested. I don't need to know that, but that's how TeamNet's set up. I can't junk those emails because it also involves good ones. So I have them sitting in my other account so I can easily just go down and delete everything that falls in that account without reading it. That can save you valuable time. It may only sound like a few minutes, but all of those few minutes add up and will give you that freedom to get rid of stuff really easily. And it is definitely worth doing. Some of you may have things that go directly into folders. If that works for you, that's fantastic. Personally, for me, once it's gone in a folder, I don't always remember to go back in and have a look at it, or I might avoid it if it has got a piece of work. But if you are good enough that you will always check those folders, that can help you. That can work across. And I know certainly recently I had somebody on one of the groups that managed to have a folder set up with a role that everything that he was CC'd into, rather than it was actually to him, went into a folder that he only checked once a week. Sounds great to me. He made sure everybody knew. So there's lots and lots of tips out there of ways to make dealing with your emails easier. I would also suggest that those of you who actually have anyone else that can get into your work calendar, sometimes it's a really good idea the day you've got back from annual leave, your first day back, to block off a part of your calendar for catching up on emails. I know that when I had a really efficient assistant manager, she would fill my first day back with people that wanted to speak to me who perhaps hadn't got hold of me. So by blocking, it stopped that happening. And by not doing that, that really assisted. So Jenny's put in the chat, you can use the sweep function for TeamNet, email reminders or anything else repetitive, and it will automatically delete or send to a separate folder. Yes, thank you, Jenny. Those of you are a little bit better with certain things like that, that's really great help. So it's really important to just find ways of dealing with these things. I know so many people that open and reopen and reread emails too, again and again, and it's really soul destroying. So really appreciate anything that you pop in the chat. So thank you again, Jenny, for helping everyone to learn how to delegate and prioritize. It is really useful if you have different ways of doing things. Another thing that practice managers are a little guilty of, as not just practice managers, but lots of people, is worrying about the everything else. Now, this doesn't make a lot of sense to you if you haven't seen this sort of graph before, so I'm going to give you an example to explain about how you can worry about or work through things that are in your control, a little bit with things that are in your influence, but the everything else you need to get out of your mind and stop thinking about it, because a lot of people spend a lot of time in the everything else. So the example I'm going to give you is back for a couple of years ago. And a couple of years ago, out of the blue, the government told us that actually, instead of starting to vaccinate people in September, as we had done for many years for flu, we were going to instead do that in October. At the time, we probably had all organised to get those vaccines in September. We'd really fought for those early dates, which sometimes we had assumed all of those vaccines would have gone by the time you got your second lot through. So now you're looking at fridge space and things like that. Basically, There's lots of bits within our control that we can think about with that. So we could have thought about what to do about that fridge space. Do we need to order an extra fridge? Should we at least make sure that they're serviced and managed so that we're not going to have a fridge issue? We can get our patients aware that things have been delayed, not through our fault, but everywhere. So therefore, we'd like them to stick with us. We can start, because it's in our control, to have meetings with our nurses and our teams to get them ready and understanding that perhaps we're going to need a bit more of their time in October. Perhaps they could keep some weekends free and do a little bit of extra work for us. It's within our influence to persuade our staff that maybe they'd like to work on a Saturday. Your persuasion could be a bacon butty or time and a half or whatever works with your teams. It's within our influence to have everything ready, get those appointments on so people can book early and remember to use us and not the pharmacies, to work with our patients. All of that's in our influence, but the rest of it's in the everything else. Unless you work for NHS England, or unless you're a really good friend of West Streeting or whoever's in charge at the time in that area, you are not going to be able to change that date. I worked with an awful lot of practice managers that spent so much time here in the everything else saying, yeah, but it's going to be really bad. What's going to happen? We're not going to be able to manage because it's October. And what if people go to the pharmacy and and getting themselves very stressed? And that time is a waste of time when you can be working on other things that actually you can make a difference on. It's very difficult to change that mindset if you are someone that spends a lot of time in the everything else. But sometimes it is worth doing and worth thinking about to start moving forward. So thinking about changing your mindset and not worrying about the everything else can really start to give you more time to actually think about the stuff that you can control and you can influence. I'm asking you to really try and rethink on ways of doing things. And I know it's not easy, but it will help you. It also helps you when you're working with your team. So another very quick example with that is care navigation. You can do all sorts for your team to keep it in their control, maybe use an F12 key so things are easier for them and things pull up and give them the training they need. But as far as those team members that spend every time in the everything else complaining that they have to do this and things, it's quite good to have that conversation with them. We can't do anything about this. This is contractual. Stop worrying about the everything else. What can I do to make it easier for you? And sometimes that can be a really useful tool to change the way you talk to people and help work through those things. So we're going to go to what we talked about at the start, which was delegation and how we need to work with delegating to our team to try to make things better, easier, and working with your team can actually change their mindset a little bit about the job that you do as well. So the first thing to do that is quite challenging for many of you is to learn how to trust the members of your team. They do say that a really well-run business, and I'm not convinced of this completely, but they do say that a manager should be able to go away for 3 months and that business still run itself, because you will have all of your team worked, ready, understanding how to cover things. Now, I think 3 months is probably a bit too long, but I certainly know of managers that can't even go for a training day without having 15 phone calls. That doesn't mean you're great at your job. It doesn't mean you are the best manager and the place can't survive without you. It probably means that you haven't got your team trained up well enough to be able to take over these areas and be able to do some of that stuff and to manage without you. You are not their mum or their dad. You are actually their manager and they should be able to work forward. You need to be able to learn to delegate, but not micromanage. We do have to manage a little bit more when we are first teaching someone how to do something, but then give them that freedom to do that work themselves. And therefore that can actually ease time and have them doing work so you can concentrate on other things. Learning to share the load will build your team. And as your team builds, that is great for succession planning. If you're like me and you were just thought, right, I've had enough, I'm retiring, then you should have someone in place that can step up and do 90% of that work anyway, even if it's a multitude of people who just can do a little bit of what you do. You should never be afraid that by teaching someone, they're either going to leave you or they are going to be at your ankles, snapping away to get your job. Have the confidence in yourself to know that by teaching them, it means you can happily go on holiday for 2 weeks, sit on a beach and totally chill out rather than having to worry about all the stuff that will be left for you when you get back, because you should have learned that your team should have learned to be able to take over and do parts of that work for you. A well-run practice isn't one where only the manager can do everything. It's where everybody can do a little bit of the role that you do, just enough to keep it ticking over. Always good to form a written structure and share it with the team. And the reason I suggest doing that is because it reminds them of their responsibilities. And we will be giving you a copy of that written structure to show you how this can work. And the next slide will show you what that will look like. But it's a really good quote here to say that leadership is not about being the best. It's about making everyone else better. And that's something that we need to do. I am certainly not the best in any team I've been in at every single part of it. But what I do is I hire really good people. So I've always got a good IT person. I've got a good health and safety person. So I am great at the overseeing, but you shouldn't be doing all the work. You should be being the overseer. So if you do something like this with a written structure, you can have a leadership plan, which will help teams take ownership of their work. It makes, you can divide each part, and when you get your copy of this, it will show I have a part for finance, a part for HR, and you divide what bits they do. So if somebody's in charge of, say, petty cash, but they avoid keeping track of it, you can remind them, here is our leadership plan. This is your part to play in that. It's also really good to hand those to your partners and to be strong with your partners. So when your partners knock on your door and come to tell you about a reception issue, you say, that's great. Have you told the reception manager? Because if we look at the chart, she's in charge of dealing with problems that happen in reception. It will take a while to get your partners used to it, but it does work in the end. And I've worked in several practices and I've used this, and eventually we can train our partners to go to the right people. And that will take some pressure off of you. Only coming to you if they have given something to someone and that hasn't worked and that hasn't been resolved by that person. So that way you keep track of things. It's great to have team leaders, but if you have team leaders, you also need to meet with them all for each of your areas and make sure that they are working okay and give them the opportunity to feed back to you. That's the same if you put people in charge of projects. Just regularly meet to make sure these things are being done, but do make sure that you allow people the autonomy to manage their own smaller teams, because again, it's great for succession planning. Do have a look at your workforce. Are they working correctly? Because that will help with your prioritisation. Or have you got nurses doing HCA work or managers doing even basic admin? I have seen it a lot. I actually worked with a manager who had her assistant manager photocopying for 2 days a week. Not only was it a waste of money, but that assistant manager was getting very bored because she felt she should have been working at a higher level, which she should. So she was looking for another job. Instead of having that conversation and thinking perhaps that's not a good use of her time, that hadn't happened, then you are landed with a whole lot of recruitment to do, which fills up your time a lot more. So it is really good to learn to talk to your team, but also make sure financially that they are working to their highest standard and not doing the easy stuff, because we can all do that. Recruitment's really expensive and recruitment's really timely. So when you've got a person that is working well, you want to keep your team. And sometimes for that, we need to think about our relationships with our team. So we need to appreciate their skills and knowledge. Do remember to actively listen to people. And remember, you can have a relationship with your team without being their best friend. Give positive feedback. Do seek advice from them. It's really nice sometimes to ask them, how did you do that? How did that particular thing work? For me, it was always IT. I'm not great with IT. So I will go and I'll ask someone. We can learn a lot from each other. If you're getting on a little bit sort of older, as I am myself, sometimes you can learn heaps from people that are a lot younger than you because they've come through a different schooling system where they've actually learnt on computers rather than it being something that you found as you got older. So sometimes we can get great hints and tips from all of those around us. It's also good to look at your team, to think about things like we're going to need to all learn AI in the future. Get someone in place now that can take that role as an AI lead and teach other people. That will be one less job for you to have to learn everything. Always look at things that you're not great at yourself, that somebody else maybe will be better than you. And that's wonderful because they can do that piece of work for you, but report back to you. So you may have the ideas, but not the way to put it together, but someone else will be able to put it together, but maybe wouldn't have had those ideas. So working together can make your prioritizing of jobs so much easier. And the final sentence on here is something that actually was a member of staff suggested to me because maybe it's something I'm not great at to do. Remember your basic conversation sometimes. I have a habit of going straight into what needs to be done without remembering always to say, hi, how are you? Many of you may not be guilty of that, but because I'm often bang, bang, bang with work, that's something that one of my previous assistant managers told me I should always put on a slide, maybe to remind myself that basic conversation keeps your team happy. That will depend on your personality. But what we do all have to think about and what we all can be guilty of is emotion management. So this is a Steve Jobs quote. And it says, if you want to make everyone happy, don't be a leader, sell ice cream. And the reason that's really, really important and that we do need to know these things is because if we are everybody's best friend, then sometimes dealing with disciplinary issues or HR issues can be really, really challenging. It's all so much easier when you can keep your emotions in check, when you can be calm, be definitely the boss. You can still be friendly, you can still go to the Christmas do, but if you are not somebody's best friend and then having to deal with disciplinaries with perhaps that person or accusations of maybe moving somebody up, not on their merits, but because they're your friends, you can take all of that out and have that emotion management by not being close friends with all of your team, because sometimes you need to take that step back and deal with the really difficult stuff. I've been talking at you a lot. Is everyone okay out there? Any questions so far? Or are you all just thinking, oh no, this is far too much for me to have to remember? No questions? Okay. So when we have to prioritize our work, some of that is organizing and for part of our prioritization of our workload. And we need to look at our time management. You have to think, and this may not be you, but it may be you, or it may be a member of your team, and this might be a teaching for them. I've always had somebody within any team I've worked at that's really good at what they call productive procrastination, doing stuff to be really busy while avoiding what really needs to be done. So I had a fabulous girl that worked for me, and she was the busiest girl you've ever seen. She was always full on, but her work was never ever completed. And when you watched, it was because she would run around helping people with the stuff that she found interesting. Oh, you're setting up a search. I'll set that search up for you. I love setting up searches. Let me set up the search. I can run this for you. That looks really interesting. Running around doing everyone's work, but not her own. If you have members of your team like that, although it's lovely that they're being really helpful for other people, you have to sometimes rein that in. and make sure that they're actually getting their work done. Set them times to come to you and show you the work that they've achieved. Give them deadlines, as you may be needing those deadlines yourself. Making sure that we are not productively procrastinating and we are actually getting on with the work that needs doing. So if you've got some challenging piece of work from the ICB that you need to get through, make sure that you work on getting those things through to deadline, getting those things out on time, even if it's really boring. And a good way to do that is to divide up your work, dividing the urgent or the non-urgent work. We can think about how we will put through what we need to manage, what's really important. And some of that might be a last minute thing that comes along, like a complaint or a major issue that happens within your surgery. So you have a bit of time built in for that kind of thing. Then you'll have your focus work that needs doing. And some of that focus work will be things like your ICB submissions. But then there's things that we can avoid, and some of that can be avoided will be those emails that we talked about earlier, but we can also manage to avoid some interruptions or some different calls by training our reception staff. I know it was really important when at each place I've gone to stop that phone calls that come through, call for you, bang, come in from reception, or there's someone to talk to you about the gas and electricity and changing your contract. I will call them if I want that. So I've stopped any of those types of calls coming through to me. And it's really challenging at first because the reception staff are busy and they want to get rid of that call the quickest way possible. But I've told them they can tell those people no, because I'm not going to be interested in giving them a list of things I won't be interested in. But if they do want to get that call through to me, they're going to have to type up everything in an email, send it to me with the details, and then I will phone the person back. It's amazing how when they have to do all that typing, a lot of that work stops and I don't hear from them. Because some of that is for the receptionist to get rid of someone quickly without being rude. But then they're stuck with you. So if you can work with your team to stop putting every call through to you, it will give you a clear headspace to get on with time. Close your door. You've got to learn how to, or teach your team what to do when you close that door and they cannot interrupt you. It doesn't always work. I'm quite aware it doesn't always work. I know I've got a sign that happily sits there that says, doing payroll. If you come in, you won't be paid. They don't come in then. It works. You can only get away with that one once or twice a month. But sometimes you need to be a bit more forceful. You may need to actually start locking your door. Partners will always come in. If some of you could control that, then you've done really well. But definitely your team's coming in with nonsense stuff. Sometimes you need that quiet time. So as long as that quiet time is kept so that there is time that you are available, you do need that definite quiet time at other times to do that really challenging work. And sometimes that can be a conversation with your partners to ask to actually work at home when you're doing the accounts or you're doing something you need to get your full concentration on, when perhaps the continual flow of interruption isn't going to make that really challenging for you, because you can get involved in conversations that will go on for a long time, and therefore you're missing time that you could get on with other pieces of work. Anyone else got any great top tips for keeping the reception team out from running into your room, or the clinicians? If you have got any top tips, do please pop them in the chat for other people, or if you've got anything that really works when you put it on a notice on your door, then that would be really useful for everybody else, because I think most of us have that continual flow that comes in at times, and that can be really difficult to deal with. Yeah, work from home from Danielle, exactly. Sadly, you need to be there some of the time, because otherwise the team get quite unruly if you leave it too long. But for me, a day from home a week is the only way I can keep on top of the really important stuff all the time. And I know when I started to work from home 1 day a week, my assistant manager said her workload went up with stupid queries of people coming that they would never have dared to ask me. Even what time should I eat my lunch, I think was the worst one. Not because they couldn't sort it out between them, but she basically didn't want to even make a decision. So sometimes things are really silly that they come to us, and we need to stop those things, but without people thinking that we're horrible, because they need to be able to talk to us if it really is important. You can see Jenny is furiously typing, so hopefully we're going to get some ideas from her. And while we're waiting to see what other tips you've got, we'll talk about outsourcing. So Jenny's put your headphones on, even if you're listening to the radio. Yeah, that's a good idea, actually. You make yourself look like you're in the middle of a call. I've never actually done that, but yeah, that actually makes a lot of sense. Sometimes it's just really important that people realise you have stuff to do too. And you can't just be there every minute when they want you. And sometimes they need to think for themselves. Sometimes it's a case of going back to them and saying, right, well, what do you think you should do? We'll do that then. And it's really just trying to train your team. So thank you for that, Jenny. One I will start using. We do need to think sometimes about outsourcing when we're looking at the new 10-year plan. There is a plan in place where PCNs or bigger groups, even of surgeries, are all going to start working together, and all of their admin will be done together and all of their appointments. So it sounds, well, I don't know, it's 10 years to get all this in place, but certainly sometimes it's worth thinking about outsourcing and subcontracting. If you are doing big pieces of work and you've got a team that's, say, prone to sickness, or you've got 2 or 3 people leave, and it's the time to actually reorganise when people are leaving or people are cutting hours, so you can actually have a look and see if things are worth doing. I know I've tried it with coding and summarising records. It's been quite useful to look at outsourcing, because sometimes you're then only paying for a certain amount of documents, and if you've got lots of team members off sick, don't forget you are paying for their sickness or their annual leave and everything else. So it is worth doing a bit of study and time on that. Typing, there's a few places out there that will type your letters for you if you're not fully using sort of AI and various other bits. There are people that will actually physically type for you. Lots of admin that you can outsource. And when you're outsourcing, don't forget to remember people's on costs, which are really expensive when you're replacing someone with pension payments as well, and that employer's NI. And it also is that guarantee that work will be done. Often you can get a contract with someone where they've got a large team, and you will have X amount of documents perhaps coded, rather than just thinking about, well, 2 or 3 members of staff are off and that coding is piling up. So sometimes you have to look outside the box. Think about any digital technology that might be able to save time for you. Certainly with insurance reports, there's companies out there like iGPR. Doesn't have to be them, but it's also worth just sitting down and doing a time versus cost study. I know when we started to outsource all of our insurance, although we were paying for that piece of work to be outsourced, they were quite keen on just putting up prices, and the patients just paid it because it was an outsourced company. So therefore, we actually got more money in for our insurance reports that year, because all the prices have been put up by somebody else, and then my doctors and my admin staff didn't have to cover anything. So sometimes it's really worthwhile having a look at that kind of thing. Just think, when you're doing it, work out staff time, including their on costs, their sick pay and their annual leave, to work out your costs. I'm sure by now 99% of you are on cloud-based accounting. I think it's law from next year that we're going to have to be. If you're not, then do get switched over, because that saves hours of time as things are sucked through from your bank statements into your account, so that you know they're updated and correct. can save hours of time, and do make sure you use everything on them. The report systems are great. You can look from year to year, as long as you've coded everything correctly, to see how well the finances are going. And if your partners ask you to provide some big report for a finance meeting, it's pressing a button rather than hours of your time. Yes, you'll have to understand and know and put the work in to code things properly, but once that work's in place, you can keep moving forward and it can save a lot of time. And you also start thinking about planning your year ahead. If you're not someone that does that and you leave everything to the last minute, do you really need to plan across the whole year? Where they say a dog is not just for Christmas, well, quaff isn't just for February. It's 12 months. We need to get things working right across the 12 months and keep things up to date so that we can hit all our targets without that panic time and the paying of overtime in the last couple of months. Plan for year end, have everything ready and in place. We do have a year end masterclass that we're running, and this year's year end masterclass will have a lot of stuff about all the new HR rules coming in. So if you want to save yourself some time and you can come to that year-end masterclass, GP Excellence will have it out on their regular emails. There will be lots of the stuff on the HR. So for your prioritisation and saving time, could be that I've already done the action plans for you and you can just grab those and use those. So hopefully that might help you. One really big tip that I would suggest you do is work through your team, and this may take a long time, and get them to write a protocol for every piece of work they do. Make them to write it very, very basically. So it's even to the point where they're saying, click the button in the top left, pull the drop down, this is the area you go into, click that and carry on. And teach them to write a protocol in that much detail, perhaps with screenshots and pictures. And why that's really useful is most of our staff are on 1 month notice period. So if somebody decides to leave and therefore you have to replace them, by the time you've got somebody else in, then it's going to be really challenging to have any handover time. So you are on the back foot with how they do various things, unless you know how to do everything in your practice. I certainly wouldn't know how to do everything. If those protocols are written up and checked regularly, that means you've already got a teaching plan in place for your next person. And that can be really, really important and save you time and energy. Don't be writing them yourself. You don't have time, but give each of those team members certain protocols to write, how they work with an insurance report that comes in, how they summarize a record, how they code a record. Make sure everything's in place so that you can just pass that on. And that's also really, really useful if somebody goes off unexpectedly on long-term sick. If they keep everything to themselves, then they suddenly go off sick and you don't know what's going to happen. I know I had a member of staff who fell down the stairs and broke her back. It was never been off sick before, suddenly out for a year, and to figure out everything she was doing was really challenging. So we started on the protocols. Please add in the chat if you've got any suggestions or ideas for anybody else about protocols that you feel are really important to have in place. These are not the same as your policies. This isn't something you can grab from Practice Index or whoever you use for your policies. This is very specific to your practice on how you work and how you do things that can be really useful to pass on to other people. So really do have a think about that. Divide up that job between your team and get them to do it. Okay, it's a big piece of work now, but when it's done really well forever, and you just need to update each year as things change. So hopefully that's given you a bit of food for thought. And our final bit of food for thought is resilience. To stay on top of everything, you need to be really resilient. So as part of your resilience, we do talk about keeping your space clear of clutter, eating a bit more healthily, drink water, not too much caffeine, get your sleep sorted. Rather, we're not going into that today. Today is not a resilience session, but there is a training session on resilience for managers. And there is a video that we've made on staff resilience, which may be of use to you as well when you have to plan something for PLT for your staff. So again, with that, figuring out things to save time, feel free to look on the GP Excellence website, where they have got that video set up on how to keep your staff resilient. It is made for your staff to sit and watch, so you can pop on a video that will last nearly 2 hours in their PLT and give them some teaching and learning at the same time in something that may be useful for them. So another way of saving a little bit of time for you by utilising things. And on that, if you are trying to succession plan or teach your member of staff something, please do have a look at the GP Excellence videos. There is a whole raft of videos on how to do various different things in your skills, which are really good for succession planning training to save you doing everything. It can work alongside your training with your staff member. So hopefully that taking part in that resilience will give you that extra oomph to make you feel good. And I'm hoping we've gone through a few different things today that you can have a think about in changing the ways that you work. So if we think back, we have looked at action planning all of our enhanced services, which should help and assist us. We've looked at ways of working through our emails to make things easier and quicker. We've looked at trying not to worry about the everything else. We've spent quite a lot of time thinking about delegation and how that can work to make sure that we get through things in a better way. And again, we've looked at time management to make sure we know different ways of managing our time to make things easier. I'm hoping that's all been useful for you, and I'm here for any questions. If not, if you don't have any questions, then have a wonderful rest of your day. And if you are doing the apprenticeship, the level 5, I'm hoping this has given you a little bit of useful information to put there within your off-the-job training time. There will be a certificate that will be available to show that you've attended a training today, and that will come out with all the documents that will come out to help you do some time saving. So thank you very much, everyone, and I will see you on the next one. Those of you that don't know, I'm retiring in March, but I will be here doing a few more training sessions between now and March with you all. So thank you very much. And thank you, Jenny, who added a few really useful tips into the chat, which has been really helpful. It's always nice when somebody interacts back. So thank you very much for that. Take care.